The following video is going to be the most honest lecture you will ever watch regarding the maxillary bone. The monopoly of your beauty. In every way, shape, or form, of course, it's the maxilla. It's the growth hub that determines how your face develops, how you breathe, how your teeth fit, and even how attractive your face looks from every single angle. For starters, the maxilla grows in 3 planes. Number 1, anteriorly or posteriorly, aka forward and backwards. This affects how far your midface projects or retracts. Number 2, transversely, side to side, aka medially or laterally, which impacts palate width and nasal cavity space. And number 3, vertically, up and down, which influences eye support, under eye hollowing, and smile aesthetics. So one of the main determiners of facial development is actually tensile forces. Muscle activity, breathing patterns, chewing, and tongue posture, these are all natural occurrences. This is called the functional matrix theory. If you breathe through your mouth, chew soft foods, and slouch, your maxilla will grow forward naturally. So yes, this leads us to the first realm of maxillary adjustment. This is the natural way of doing things. Proper tongue posture, natural breathing, hard chewing, and myofunctional therapy are your biological toolkit. But unfortunately, trying to sporadically use these tools mid to late adolescence / early adulthood will often fail. Structures are ossifying. Those old growth signaling pathways you had when you were a kid are not as active as they once were. Things are setting into place, and those old tools have failed you already by the time you realize it's too late. During your earlier years, these tools stimulated periosteal growth and forward expansion, but the static hope isn't fully gone until the age of 25 or around 22 for women when the sutures are still partially active. Of course, these are just median ages. Everyone's hourglasses function at different rates. Now, for orthodontic assistance, devices like palatal expanders, Damon braces, and face masks apply directed force to move the maxilla forward and outwards. As there are some solid options for teens and young adults, especially for expansion, most of these options are best performed or only being able to be used when you're still a young child. Now let's go over peptides and pharmaceuticals briefly. Emerging research looks at peptides like IGF-1 and CJC 1295 for their role in osteogenesis, potentially aiding facial bone growth. Anabolic steroids like low-dose oxandrolone has been studied in craniofacial syndromes to enhance maxillary bone density and size. Now for surgical options, procedures like Lefort 1, 2, or 3 osteotomies allowing for 3D repositioning of the maxilla. But it's not just movement. Many patients also need augmentation. This could mean fat grafting, implants, or even bone substitutes like hydroxyapatite. Morphologically, some people have narrow deficient midfaces, and they need volumetric reconstruction, not just realignment or repositioning. And one of the main problems about Lefort 2 is bringing the maxilla forward without matching mandibular position can create a disharmony. That's why also procedures like BSSO, bilateral sagittal split osteotomy, or genioplasty are often used during or post Lefort to align occlusion and aesthetics. The two bones, maxilla and mandible, function as a tight biomechanical and aesthetic symbiosis. You don't just move bones, you reshape how they function together. In the next video, I'll dive deeper into some surgical scenarios.